What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Hi, and welcome to the Inflammation Investigator. Today, we're going to talk with a naturopathic doctor, and we're going to talk kind of all things inflammation and especially tick-borne diseases like Lyme. So if this is something that's affected you, you're definitely going to want to tune in. Today, my guest is Dr. Darin Ingels. He is a licensed naturopathic doctor, author, international speaker, and leading authority on Lyme disease. He's a former Lyme patient himself who overcame his own 3-year battle with Lyme disease after having failed conventional treatment and became progressively debilitated. Dr. Ingles found that proper diet, lifestyle management, and natural therapies worked with his body to heal it instead of against it. He then applied what he learned about his own healing journey to his own Lyme patients and found they recovered faster and with less side effects. Dr. Ingles has now treated more than 8,000 Lyme patients using his novel approach, many of whom have gone on to live healthy, symptom-free lives. Dr. Ingles has been featured on WebMD, Mind Body Green, Be Well, Thrive Global, Motherly, and Dr. Ron Hoffman's Intelligent Medicine podcast, and is the author of The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. Welcome, Dr. Darin.
Oh, thank you so much, Elizabeth.
Well, this is such a treat to have you today because I personally have known many people who've had Lyme disease, and it can be so frustrating to have it linger, and nobody can quite figure it out. And then you become progressively more and more distressed and disabled, I'm going to say, in many ways. And oftentimes the medical doctors really can't help, and they feel like there's nothing that they can do. So why don't we start with you telling us your story? How did you get here?
Yeah, well, after I finished my residency, I was in Seattle. I moved to Connecticut. And for those who don't know, Lyme disease is named after Lyme, Connecticut. It's a city in Connecticut that's on the coast. And I lived about 30 minutes from Lyme, Connecticut. And about 2 weeks before I opened my own business, I started getting really sick. I had 105 fever, I had joint pain, I had neuropathy, I felt like my back was broken, I had a migraine headache. And when I was in college, I had meningitis. So I thought I had meningitis again. And I was actually on my way to the hospital or getting ready to go to the hospital. And my ex-wife had said, "Oh, what's on the back of your leg?" I can't see the back of my leg. So I did the double mirror thing and I saw a big bullseye rash on the back of my left leg. And I said, okay, well, I know what this is. So I went to urgent care. I got, prescribed antibiotics, doxycycline, which is the conventional treatment. And after 4 or 5 days of treatment, I mean, all my symptoms really went away. But for anyone who's ever opened their own business, they know what it's like. It's very stressful. At the time, I couldn't afford staff, so I was at the office 6, 7 days a week, long hours. And about 8 months into that schedule, I started to get symptoms again. Started getting joint pain, started getting neuropathy. I really felt unwell, and I felt, okay, well, this is like, what I had before. Fine, doxycycline worked beautifully before. I'll just do it again. So I took a month of doxycycline, didn't touch it. Took a month of azithromycin, didn't touch it. Then I started working with a local Lyme doctor, and we were doing combinations of oral antibiotics, and did it for about almost 9 months, and was actually getting worse. The antibiotics were destroying my gut. The inflammation wasn't getting any better. My symptoms weren't improving. So I went to see a medical doctor in New York, who's also an acupuncturist, and he started treating me with Chinese herbs, and kind of also the realization that I really wasn't, eating well and sleeping well and taking care of myself. But once I kind of did all that, within about a month or so, I felt 85% better. So it was my own reminder that, natural things work really well. I had kind of strayed from that because I just, being new to Connecticut, new to Lyme disease, this is what you do, and it's even what I learned in school. So it took about another 2 years to really feel like I got to a point where I was symptom free, but eventually got there. And over that 3 year haul, really learned a lot about myself and learned about how to manage Lyme. And that again, it's really not just about killing the bug. We have to look, in fact, all these other things in your life that control your immune system, that control inflammation, and of course it's diet, it's lifestyle, and many other factors. So any healthcare provider who's had their own personal experience with a health issue, gets to be an expert in it pretty quickly. And again, here we are, many years later, and thousands of patients. Fortunately, I've been able to apply what I did for myself to the people I work with, and many of them again go on to live a much healthier life.
So let's talk a little bit about Lyme. So you were put on antibiotics, but is Lyme a bacterial infection?
It is. Yeah. So Lyme is primarily caused by an organism called Borrelia, and there are different strains of Borrelia. Borrelia burgdorferi is the primary strain that we see most in the US, but we've now identified several other strains that can cause Lyme disease. At the end of the day, the strain probably doesn't matter. I mean, Borrelia is Borrelia and the way it impacts people. We know there's over, 300 strains of Borrelia in North America and worldwide. We don't even really know how many strains are clinically relevant. It's probably about five or six based on our current technology. But it's an unusual bacteria. It's what's called the spirochete. And other spirochetes out there, syphilis is a spirochete. There's one called leptospira, which is a spirochete. So it's kind of this corkscrew shaped organism. And that shape allows it to behave a little bit different than other bacteria like strep or staph and other things people commonly get sick with. That corkscrew shape allows it to burrow into tissue. It can invade cells. It can actually even coil itself up into a little ball, which basically allows it to hide from the immune system. In addition, it's also a very slow growing bacteria. Most bacteria replicate every 10 to 20 minutes. Borrelia replicates every 1 to 16 days. That's incredibly slow. So when we talk about
Wow.
treatment, there's a reason you can treat strep throat in a few days of antibiotics, where with Lyme, because it's so slow growing, it's a much longer course of treatment. And ironically, the conventional treatment is really only 2 to 3 weeks of antibiotics. But most of us who treat a lot of Lyme patients recognize that it's not nearly enough to really eradicate the infection.
So that makes sense because I know that most courses of antibiotics don't really do it for Lyme. So that's because the replication rate is so much slower. Is that what you're telling me?
Absolutely. Well, and again, the conventional treatment's doxycycline, and a lot of people don't realize that there's really two different types of antibiotics out there. There's what's called bacteriostatic and bactericidal. Bacteriostatic, which is what doxycycline and azithromycin are, they don't kill the bug. All they do is they stop it from replicating. So it still depends on your
Mm.
immune system's ability to identify and eradicate the infection. Where other drugs out there like amoxicillin, Augmentin, Keflex, they actually kill the bug. So again, if you think about it, it's like you're giving an antibiotic that doesn't actually kill the organism, it just stops it from replicating, but it's got a very slow replication cycle. So if it replicates, we'll just say take the lung in every 16 days, and you've been prescribed 14 days of doxycycline, in theory, you haven't even covered one replication cycle. So it's kind of odd, and sort of as a comparison, if someone gets tuberculosis, which fortunately we don't see much in the U.S. anymore, but Mycobacterium tuberculosis is a slow-growing organism. It replicates every 15 to 20 hours, which is still slow compared to 10 to 20 minutes. Well, TB patients get a triple antibiotic cocktail for up to a year. They get heavy
Right.
duty antibiotics for a prolonged period of time because they recognize it's such a slow growing organism. So why are we treating Borrelia different than TB when it's more slow growing than TB? I mean, it just biologically never made any sense to me. So I think, what we have is a, fairly large percentage of people out there that are really getting under treatment just because they're not getting potentially the right antibiotic or certainly for long enough.
So Lyme disease is a tick-borne infection, correct?
Yeah.
And so ticks are what we call, oh, I'm going to blank on the word here, um, external parasites. What's the word I'm looking for?
Well, we call them vector-borne
Mm, thank
illnesses,
you.
ticks and mosquitoes and basically biting types of insects. So yeah, I mean, the overwhelming majority of people, 99% of people who get Lyme disease acquire it through a tick bite. We have very little evidence that other insects can transmit Lyme. Now, other insects can transmit other infections that can look like Lyme, something like Bartonella, which is a different kind of bacterial infection that can be spread through fleas and lice and other biting insects. But Borrelia itself, again, there's very little evidence outside of ticks. We also know that pregnant moms can pass it down to their babies. So if
Ooh.
mom has Lyme disease, there's a potential she could pass it on to her child. There's some debate about sexual transmission of Lyme, and there's honestly very little research out there. I think most of us in the Lyme world feel like it's possible, but not probable. But again, the majority of people will get it through a tick bite.
I do know some people who've had Lyme disease who've never actually seen that bullseye that you have described that you saw, which is also, I always think that, oh, great, you saw the bullseye. Now you know for sure you have Lyme. And if you don't see that bullseye or you can't remember if you ever saw it, or maybe it was in a position on your body where you couldn't see it yourself, like yours, I think that's very frustrating for people when they are sick and they think maybe it's Lyme, but they never saw that tick bite. So,
Yeah, the bullseye rash, again, yeah, it's one of those things where if you see it, you absolutely know there's nothing else really that causes that specific kind of rash. Unfortunately, again, most people who get Lyme disease do not get that rash. The CDC says
ah,
60-70% of people get the rash. If you look at the research, it says it's probably around 40%. In reality, it's probably less than 10%. So it's just unfortunately not a reliable marker. Again, most of the people I work with have no idea they ever had exposure. They never found a tick on them. And understand
oh,
these deer ticks are incredibly small. They're about the size of a poppy seed. And they tend to go
oh.
to the warm, moist areas of your body, which are not the areas you see behind your knees, in your armpit, behind your ears, and your hair. So, and ticks have anesthetic in their jaws. So when they bite you, you can't feel it. So here you got this teeny tiny insect. You can barely see it. You can't tell when it bites you. It likes to go to parts of your body you can't see anyway. So again, most of the people who've been bitten by a tick just never ever have a clue. And again, if you don't get the rash, you would not have a physical, at least a initial sign that you had that exposure. And this is part of the frustration of what causes all these problems is that people feel sick, they go to their doctor, they've got this collection of vague symptoms, and we call Lyme the great imitator, the great mimic. It looks like a lot of other stuff. There's over 100 symptoms associated with Lyme disease. So if you go to your doctor and have flu-like symptoms, you're tired, your body hurts, you've got joint pain, neuropathy, maybe you're running a low-grade fever, it could look like any number of other infections. And they might tell you it's viral, it'll pass, or they might give you a short course of antibiotics. But again, if you don't test, if you don't really investigate, and again, depending on where you live in the country, I mean, I was in Connecticut for almost 20 years, home of Lyme, so most doctors there were pretty knowledgeable and would at least test if people had these symptoms. I moved out to California, and doctors here still, I mean, are mostly ignorant to Lyme. They say it doesn't exist here, which is not true at all. So, if you live in an area that's not necessarily known to be endemic for Lyme, unfortunately, you have a group of healthcare providers there. It's just not on the radar, and they never bother testing for people. Uh, Beyond that, the testing itself is problematic, and just that it's not very sensitive. If you look at the research on the standard blood test that all the big box labs offer, it's only about 43 to 46% sensitive, which means it literally misses more than half of the people out there with Lyme disease. So if you go to the CDC's website, they even say Lyme is a clinical diagnosis. It's not a laboratory diagnosis. So it's really based on your signs and symptoms, and particularly if you do live in an area where deer ticks exist. But it's one of those things that gets missed a lot.
Wow, I knew it got missed a lot, but I didn't really understand why it was missed so much, but that makes so much more sense now. Now, I know that when you work with Lyme patients, you do more than just antibiotics. What are the other steps that you think are necessary for someone to heal from Lyme disease?
Well, I honestly rarely use antibiotics, only in that the majority of people I work with do not have acute Lyme disease. If you're going to use antibiotics, when someone has acute Lyme, they're recently exposed, that's the best time. When people have had this for months or even years, I find antibiotics don't work nearly as well. They tend to cause more problems than they help. So, of course, I'm a naturopathic doctor by training, so I use a lot of herbs to target the organism. And the beauty of herbs too is that they're very chemically complex plants, that contain constituents that target the organism, but they also are anti-inflammatory and they promote better circulation and they support the immune system. So it really gives us the ability to mix and match different plants for each person to really find out what their body needs to help overcome the infection. But going again just beyond treating the infection, I said we have to get to all these other root things that keep us as humans healthy. So the gut is incredibly important. Up to 80% of your immune function stems from the gut. So we're always looking at your gut function. Are you eating good food? Are you digesting your food? Are you absorbing it? Is there any kind of inflammation? Do you have SIBO? So, we're always kind of starting with the gut because that needs to function well for your immune system to function well and manage the infection on its own. We're always looking at various toxins in the environment that can be undermining your immune system. Mold and mycotoxins are probably the most common thing we see in Lyme patients. If you live in a home that's had water damage and you've got mold growing, that can create an element of toxicity that suppresses your immune system and make your cells sick. We talk a lot about just your internal environment, anything from chemicals you use in the home to personal care products to shampoos and all that. Reducing your body burden of toxins again is going to make your cells more efficient, make your body more efficient. And then all the other lifestyle factors, ensuring you're getting good sleep, you're moving your body, you're managing your stress. We have to look the whole of the person, mind, body, spirit, all that, plays into your ability to control not just Lyme, but really any infection. And, I'm sure if I tested everybody in New England, we would probably find 70% of people have antibodies against Lyme or one of these other infections. They don't all get Lyme disease. So, what's the difference? Well, I think the difference is the terrain. So, we need to make the terrain as inhospitable to that organism as possible. And again, that's really where we do that kind of top to bottom evaluation of everything we need to do to getting your diet set, getting your gut healthy, fixing your hormones, doing all the other things we need to do to help overcome the infection.
So, if someone comes to you and they test negative for Lyme, yet they are still suffering a lot of symptoms that are unexplainable to them, do you just go ahead and treat them as if they have Lyme in terms of helping them restore that internal terrain?
Sometimes, I mean, I do see people where, even with, I mean, there are labs out there that offer better testing than the big box labs. We use them a lot as a way to try and help assess if someone had that exposure. But sometimes they come back negative, but they've got the clinical signs. So sometimes we will start on treatment and just see is there any clinical improvement. What's kind of nice about the herbs too is just because I don't have to worry as much about disrupting the microbiome. I don't have to worry about damaging mitochondria. And because herbs do a lot of other things, even if that isn't the primary issue, there's still going to be a lot of benefits of the herbs. Again, if we can still help control inflammation, regardless of what might be triggering that, if we can help improve blood flow, if we can support the immune system, if we can soothe mucous membranes, if we can do all these other things, there still are benefits of the herbs independent of sort of the antimicrobial effect. So again, there's very little downside when you're using herbs like this. And most of what we use are generally regarded as safe. I don't worry about toxicity. I don't worry about a lot of adverse side effects. So yeah, I think that can be implemented pretty easily with people. But it's also important that we do our diligence and rule out other possibilities. So often we're doing a lot of other testing to make sure it's not an autoimmune disease, there's not some other possibility of why they're feeling the way they feel. But more often than not, we go through that checklist of other things. It's not lupus, it's not rheumatoid arthritis, it's not an autoimmune thing, it's not this or that, and you still have these symptoms. For me, the combination of neurological symptoms and arthritic symptoms. So when you get like joint issues and brain issues, there's very few things that cause both. That is a big red flag that you should be checked for Lyme or other tick-borne illness, because again, that's kind of the hallmark of these infections, is they cause a sort of global systemic symptom picture. But again, when we hear about brain fog and migraines and neuropathy and joint pain, those are the kind of things that really raise the flags that it could be a tick-borne illness.
Those are great concrete examples. I find in my own clinical practice, oftentimes when I introduce herbal remedies to people, they have a lot of fear about them. There's been so much fear mongering about herbs in our world. Do you find that in your practice?
Not so much in my practice. I mean, I think as a whole, I think when you look at the supplement industry, unfortunately, it's a very poorly regulated industry, even though it technically does fall under the purview of the FDA. You've got a lot of bad players out there. We've got lots of reports. It seems like every other week I read another report of somebody tested some supplement that didn't contain what was on the label or didn't have the amount that was on the label. So this is where, fortunately, in my field, I have access to professional companies that, you know, create these herbs much in the way that a drug company would create a drug. They do all the proper testing for contamination and purity. What's on the label is what you're actually getting. So I think if you're working with a trusted healthcare provider who's done the diligence with these professional companies to ensure that they're offering a high quality product, you're fine. But again, if you're just buying some random product at Walgreens or Costco, you don't always know what you get. And unfortunately, the big retailers, they're more about profit and money versus quality. And in most cases, you get what you pay for with supplements. To do third party testing, to do constant quality control, it's more expensive, and that's going to get passed along to the consumer. So there's a difference sometimes between the $40 probiotic and the $10 probiotic, and usually it's a function of quality.
I'm always a little horrified when I hear people have bought their supplements at Costco because they make me a little nervous about that. I know you do a lot of work in your clinic with allergies and mast cell activation, and you use a lot of desensitization therapies. Can you explain a little bit about those?
Yeah, well, I mean, Lyme is kind of an example, can be a sensitizing event for people. I see a lot of people who were never sensitive to food or mold or chemicals. And after they get exposed to Lyme or other infections, now, perfume bothers them. They can't go to the mall because they get a headache. Food, for whatever reason, now bothers them, or they go into a moldy environment and they get a headache. So, once that switch has been flipped on the immune system and people are now hypersensitized to different things in their world, even if we're effective at eradicating the infection, they're still left with the immune mess. So we have to figure out how to modulate the immune system. So in our clinic, we test a lot of our patients for their sensitivities. Food, mold, pollen, cat, dust, dog, whatever we think is triggering them. And then we've got different types of immunotherapy to help basically retrain the immune system to become more immune tolerant. At the end of the day, allergies are overreactions of the immune system. You've lost tolerance to the thing that's bothering you. Why are some people allergic to cats and other people aren't? Again, it's a loss of tolerance to that particular allergen. So, we help identify what that sensitivity is. And then, we offer something called LDA, or low dose allergy therapy, which was developed 60 some years ago by a doctor in the UK. And LDA is great because it's very safe. It's a treatment that people get every 7 weeks. So we basically, there's different mixes. There's a food mix that has about 70 different foods in it. There's an inhalant mix that has a combination of mold and pollen and animal danders and dust and things like that, and pretty much anything you breathe in. And then there's a smaller chemical mix. So with LDA, the idea is that there's something in the mix that you're allergic or sensitive to. We cover those bases. And if you're not allergic or sensitive to it, who cares, because you're not reactive to it. So the goal, though, is very much like going to an allergist and getting allergy shots. By giving you the thing that you're sensitive to at a specific concentration, again, we can start to rebuild immune tolerance. So LDA is a great option for people because it's safe, it's very easy, it's reasonably cost effective. We also offer something called sublingual immunotherapy, where we'll test people, we'll find out very specifically what bothers them, and then based on that, that's what we'll put in their bottles. Sublingual just means under the tongue. So again, kind of like allergy shots, but instead of injecting it, these little drops are put underneath the tongue. But again, we can desensitize people for food, mold, pollen, animal danders, dust, whatever is triggering them. With sublingual immunotherapy, though, this is something they do every day. And it's interesting because around the world, sublingual immunotherapy is often the preferred choice of allergy treatment over allergy shots. So if you look at most of Europe, which is socialized medicine, they're all about saving money. So sublingual immunotherapy is used first. Allergy shots are second tier. In the United States, it's the other way around. We do allergy shots, and very few allergists actually do sublingual immunotherapy. But again, it's been around for 100 years. We have over 1,000 studies on children and adults. Very, very safe, very, very effective. And it's convenient because you can do it at home. You don't have to go to the doctor's office to get your weekly allergy shot. But the concept is the same. So, immunotherapy has become such an important part of our practice because, again, if you're really talking about what drives inflammation, down to the most basic chemical level, in many cases, there's some sort of autoimmune reaction that's been triggered. There's some sort of mast cell activation. And mast cells are found all throughout your body. They're in your brain, they're in your gut, they're in your skin. And if you look at what triggers mast cells, it's primarily three things: it's allergen, it's pathogen, it's toxin, more or less.
Mm.
I mean, it can be triggered by heat and cold and other things like that, but most of it's those three things. So again, if we can identify the allergen, modulate the immune system, turn that mast cell activation off, all the stuff inside mast cells like histamine and the 200 other chemicals, that's what's triggering inflammation. If we can stop the pathogen, that's irritating the mast cell, and the pathogen directly causes inflammation. And of course, toxins like mycotoxins and pesticides and herbicides, all of those can be inflammatory. So if we can just identify what they are, figure out the best way to control it, we take that pressure off the immune system, we take that pressure off the mast cells, and ultimately the tissue's allowed to heal and the inflammation stops.
There's an article on your blog that talks about the thousands of chemicals that the US allows into our food supply, into our cosmetics,
Yeah.
into our world, that the EU has banned and always really has banned. So it makes sense. I hear a lot of people who tell me, and myself included, that when they travel abroad, that they feel great and they eat all the food and they don't have
Right.
any problems. The chemical contamination in our world, in our part of the world, in the United States, is really atrocious. How that is going on, is that something that you see a lot of in your practice?
Well, yeah, I mean, it's the nature of living, certainly in the United States. Again, there's over 88,000 chemicals that we get exposed to. Less than 200 have actually been studied for their long-term safety. So nobody really knows what happens when we get bombarded with this litany of various chemicals. And it's anything from what we breathe in the air, what we drink in the water, we get through the food. I mean, I think glyphosate is probably one of the more well-known toxic things that goes into a lot of food products these days. I think most food these days is contaminated with glyphosate or Roundup because so many farms use them. And there was a study that was done here in California a while ago looking at wine in California, and they looked at various vineyards throughout California, and some of them even were organic wines, and even in the organic wine they had glyphosate because even though those farmers don't use it, the adjacent farmer does. It gets in the groundwater and then it still gets up through the roots and gets into the grape, and therefore there's contamination. So, where you look at the EU and even other parts of the world that have much more strict regulations on chemicals and how they're used, it's different. I mean, again, I've had patients tell me for years they can't eat wheat or eat dairy in the US. They go to France, they go to Italy, they go to other parts of the world, and they tolerate it perfectly fine. So, we've got this now growing epidemic of people with food allergies, food sensitivities. I think a big driving force behind a lot of that is just the chemicals we put in food that are sensitizing people to the food, and it's not really the food itself that's causing the problem.
Yes, I noticed actually last summer I stopped drinking wine many years ago because it made me so sick. Even the organic wines would make me sick. And then I go to Europe and I can drink all the wine, or I was in South Africa and I could drink the South African wine.
Yeah.
So yes, it is. I think this is one of the big crises in our country, and I don't actually know how we're going to solve this because it's permeated so many parts of our food supply system.
Well, obviously there's a big political thing behind a lot of this, and big food, big pharma, everyone's got an agenda, everyone's trying to get their product out in the market. Um, I think we're starting to see slowly a shift in American food supply. We now have at least some big food manufacturers that are now at least saying, we'll see if they do it, that we're going to start pulling dye out of food. We're going to start pulling corn syrup out of food. We're going to start pulling certain things out. So I'm hopeful that over time that consumers will drive the market and saying, hey, we really don't want these products. I mean, the power of the dollar goes a long way. So when people start spending their money on organic food, stop buying some of this stuff. I mean, ultimately, I think that's what will drive policy. But I'm hopeful that we'll get to a point where we at least have less toxic stuff in our food supply.
I'm hopeful too. Maybe it will come about. I think it's going to take a long time to really, truly clean it all up. And there are powerful forces against this. Lobbyists are working very hard to make sure that these big food companies and big agricultural companies don't have to stop using their Monsanto products.
Yeah. Well, I saw recently, and again, nothing to be political, but I know that RFK Jr. is committed, I can't remember how many millions of dollars to regenerative farming. Again, we also need to make it profitable for farmers. There's a big shift when you move from a conventional farm to a regenerative farm. Obviously, there's a lot of cost involved. So I think as much as we can support farmers in that transition so that they can sustain their way of life and support their families, I mean, hopefully we'll start to see those things change, but I hope it happens. Hope it happens in my lifetime.
I do too, especially for my kids. So how can immunotherapy in general help reduce inflammation?
Yeah, I mean, it's really simple. We're basically turning off that immune reaction, again, that's either setting off mast cells or directly affecting the various tissues. I mean, I can remember when I was a kid, I used to have terrible knee pain. I was a basketball player. I was very tall from when I was young, and I would play, and I would just have these sore, achy joints. And again, it's kind of strange for a young kid to have joint pain, and many years later discovered it was something I was eating. I was sensitive to tomatoes and potatoes and dairy, and I ate these foods all the time. When I stopped eating them, all the joint pain went away. So when we modulate the immune system, we have the capacity again to turn off. Again, we're turning off mast cell activation. We're turning off the direct autoimmune effect that a lot of these triggers can affect the tissue. So it's really just about, again, modulating the immune system and telling the immune system, whatever this offending allergen, it's normal, it's part of my world, leave it alone, stop overreacting. And in doing that, again, we're down regulating all of these pro inflammatory cytokines, all these inflammatory pathways, and actually giving the tissue a chance to heal. Because if you look at any kind of chronic inflammatory process, wherever it is in the body, whether it's in your gut or skin or brain, that tissue never really gets to heal. And if the tissue doesn't heal, I kind of think of it as being leaky. We talk about leaky gut so much, but there's leaky brain and there's leaky skin. And that leakiness allows for things to keep passing through, that keep perpetuating the inflammatory cycle. So the more that we can improve our barriers, our connective tissue, again, that stops a lot of that process. So ultimately, immunotherapy is a way to just kind of shut down all those different pathways that end up leading to inflammation.
So people who are not near you in Southern California, I know that you have an online masterclass series. What can you tell us a little bit about that?
Yeah, I mean, I eventually developed a course for practitioners, then I kind of revamped it for the public. But for people who, are interested in learning more about Lyme disease and tick-borne illness, it's just an online program where I just kind of walk people through the different steps that I really wrote in my book. But we talk about all the individual pieces that we kind of mentioned today, where we talk about the gut health, we talk about diet, we talk about environmental control, we talk about toxicity, I talk about immunotherapy. So it's really a DIY, program that people can, really help educate themselves. I'm all for people becoming more empowered in their own health journey and not having just to rely on your healthcare provider to do everything. There's so much that people can do for themselves. And again, there's so much low hanging fruit that you can take advantage of. There's a handful of things where, you might need a practitioner to help with, but a lot of this, again, you can do on your own. So I really want to just encourage people to, again, become really well educated in this area and be able to be informed that they can make good decisions on their own health.
If there's one thing that you think everyone should be doing to help improve their health, what might that be?
Oh gosh, just one thing.
Putting you on the spot, I know.
Well, I think the one thing is, I mean, I think, you need to really be honest with yourself about how you live your life. I mean, I see so many people with chronic illness, not just Lyme disease, that aren't always doing the things they should be doing. And I am just as guilty as this as everyone else. But I think really being honest with yourself, am I really doing everything I can to improve my health? And again, that's the food choices you make at the table, the restaurant. That's the time you decide to go to bed. That's the amount of time you decide to spend with electronics. So all these little decisions every day, can have such a big impact on our overall health. So I think just be honest with yourself, really take stock of what you're doing, and can you make those little changes to have better health.
Great advice. Everyone should follow this for sure. It's the little things that you do regularly, I think, that probably make the most impact on how you feel every single day.
Absolutely.
Is there anything else that you would like to leave people with before we talk about where people can find you?
No, I just encourage people, again, if you're living with Lyme disease or tick-borne illness, I mean, hopefully this gives you a few more things to think about. And if it sounds like, hey, I've never been diagnosed, but this rings a few bells, definitely, find a practitioner who's knowledgeable in this area. I find most primary care providers are not. So you might want to search out the International Lyme and Associated Disease Society, or ILADS, has a list of practitioners around the country. And if you're not sure, you can always reach out to them to find a local practitioner to help guide you.
And you should definitely check out Dr. Darin's book, Dr. Darin Ingels. The book is called The Lyme Solution, a five-part plan to fight the inflammatory autoimmune response and beat Lyme disease. So, Dr. Darin, what's your website? How can we find you?
Yep, so it's just my name, Darren Ingalls, ND, and is in NancyD.com, and all of our information's there.
Fantastic. Thank you so much for coming on today. I know so many people struggle for so many years with Lyme disease and not finding any relief. So I think this is really important information. And it's all about inflammation here at the Inflammation Investigator, of course, and this falls right under that category. So I really appreciate that you coming on today.
Well, thank you so much for having me.
All right, until next time, we will see you back in the Inflammation Investigator. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.